Hello and welcome to another episode of Health Matters. I am your health coach today, Dr. Michael Chalemi. And on this episode of this podcast, what we're going to talk about is something that affects a lot of people, from kids to seniors to everybody else in between. And the topic that we're going to talk about is concussions. If you've ever had a concussion or known someone who's had suffer from one, or you're just curious about what concussions are and how they work, this is the episode for you. We're going to break it down piece by piece from what a concussion is to its far reaching effects on the body and what some of the treatment's options are. So, this is going to be basically your ultimate deep dive into concussions. So, first question is, what is a concussion? So, a concussion is a mild traumatic brain injury. Don't let the word mild mislead you. It can have serious short and long-term consequences depending on the severity, frequency, and treatments. A concussion occurs when a physical force, a blow, a jolt, a violent shaking of the head, or sudden impact to the body causes the brain to move rapidly within the skull. So that's the basic definition of a concussion. We're going to get into it into granular detail. So the first question you're going to ask, well, how common are concussions? So they're much more common than people realize. Approximately 1.6 to 3.8 million sports-related concussions occur each and every year in the US alone. An estimated 5 to 10% of athletes suffer a concussion during any given season. Falls are the leading cause of concussions in children and older adults. Car accidents, workplace accidents, and assaults are other frequent causes. So beyond sports and accidents, concussions can occur in any situation where the head experiences a sudden acceleration or deceleration. So let's break down what are the common causes. So we talked about them a little bit, but let's get into it. The common causes for concussions can result from a variety of scenarios where the brain is subjected to sudden and forceful motions. Here are some of the most common ones. First, falls. Typically, particularly prevalent among older adults and children, right? So seniors fall, right? Children fall all the time, and they don't tell you it hurts, but it is a common cause. Falls can lead to direct head impact or indirect force throughout the body. Sports injuries, high risk sports, football, soccer, hockey, gymnastics, rugby, basketball, and martial arts are all high risk sports, especially football, right? So you obviously have a helmet, you're going to be hitting, you're very prone to concussion, especially when you're getting forced and slammed into the floor. Rapid change in directions, collisions, or falls during any one of these activities can cause concussions. Car accidents. So if you had a whiplash type injury, back and forth motion, your head hit the back of your seat or hit the steering wheel or hit the dash, that direct impact can cause a concussion through your brain. Workplace injury. So whether you're at a construction site, a factory, or any other type of injury incident can happen where you can have a falling object fall on you. Something fell at work, whatever the case may be. Assaults are another common. It's the fifth common reason for people to get concussions. So a violent head trauma resulting from a punch, kick, blow, whatever the case may be, but the direct motion causing it can cause concussions. So basically, any type of fall, any type of accident, any type of trauma can cause a concussion. So basically, what that's really telling you is everybody and anybody is subjected to a concussion. There's no genetic predisposition, there's no predisposition of any kind. It doesn't discriminate against any person at all. Any person is unfortunately eligible for a concussion if you hit your head and you violently shake it. Okay, so now that you know that everybody's subjected to potentially getting a concussion, let's break down the anatomy to understand it, right? So I like to give you the anatomy of what's going on in the body. So the brain anatomy, cerebellum. Cerebellum is responsible for higher cognitive function, memory, reasoning, and voluntary motor motion, control. When you have a concussion, it often impairs thinking and reasoning here, right? So you might feel confused or dazed. Cerebellum plays a role in balance and coordination and muscle control. So if you get damage to your cerebellum, your ability to stand, you might be imbalanced or off. Brainstem controls basic life functions like heart rate and breathing. While concussions usually do not damage this area, severe head trauma can. Axons. Axons are stretched or torn during a concussion, leading to post-concussive cognitive dysfunction. Membrane permeability. After a concussion, the brain cells lose stable permeability, triggering chemical imbalances and causing inflammation. Okay, now let's get to the spinal cord and nervous system. Concussions don't just affect the brain, they shock the central nervous system. Here's how. If you have, let's say, you have a neck pain, you have a whiplash injury accompanying a concussion, cervical dysfunction can trigger headaches, dizziness, difficulty stabilizing your head. You could also have mid-back or thoracic pain. Shockwave pain can travel down the spine, causing tightness and changes in posture, breathing, and nerve signals. Lower back, increased tension can affect balance and mobility in the legs. Peripheral nerves, arms and legs. So when it's peripheral nerves, it's your arms and legs. Concussions can trigger nerve pain or weakness in the extremities due to your central nervous system dysfunction. So that's the anatomy of the brain. Now let's get into breaking down the mechanics of a concussion. So the brain is a soft, jelly-like organ that floats in cerebral spinal fluid inside the bony skull. While the skull provides protection, it also houses the brain very tightly. When a sudden force jars the head up or down, the brain doesn't move in sync with the skull. Instead, it propels forward or backward, a process called linear acceleration, or twisted along its axis, causing rotational acceleration. This rapid, uncontrolled motion creates a cascade of effects. So, impact with the skull is the first one. The brain can bump into the inner walls of the skull, causing bruising in localized area known as coup injuries. In some cases, it may also rebound and strike the opposite side of the skull, leading to contra-coup injuries. Next, you could have axonal stretching and shear forces. So the rapid movements stretches and compresses or twists neurons and axons, basically the long projections of the nerve cells that carry the signals. This phenomenon is referred to as diffuse axonal injury, DAI, even though it is typically microscopic in mild cases. Chemical imbalances. So the stretching and the physical damage to the brain cell can trigger a release of neurotransmitters, basically the chemical signals. These abnormal releases interfere with the electrical signals in the brain. Additionally, damage to the brain cell membranes leads to a flood of ions like calcium and potassium in and out of the cells, causing further biochemical disruption. Energy crisis. So a concussion creates a intense demand for energy in the brain as it tries to restore chemical balance, but blood flow to the brain is often reduced after an injury. This disparity can lead to temporary metabolic dysfunction as the neurometabolic cascade of a concussion. So let's get into what are some of the key characteristics of a concussion. So the hallmark trait of a concussion is neurological dysfunction. So basically, the brain's inability to work as it normally would. This dysfunction can result in physical, cognitive, emotional, or behavioral symptoms. Because concussions are functional injuries, meaning they affect how the brain works, rather than structural injuries, meaning like visual damage, like bleeding or fractures. The effects aren't always obvious on imaging like CT scans or MRIs. Common physical disruptions can be temporary confusion. You might feel very dazed or confused. Headaches due to increased pressure or chemical imbalances in the brain. You might be nauseous or vomiting due to brainstem involvement. You might have visual disturbances. You might have double vision or blurry vision that's linked to the brain's occipital lobe or vestibular system. Let's talk about some of the cognitive common problems. So, memory issues, especially with recent events. It's like anterograde amnesia, so it's very temporary amnesia, poor focus or difficulty processing information, slow reaction times due to impaired neural signals. Now let's talk about sensitivity of the brain. So it's important to remember just how sensitive the brain is to trauma. Even small forces can disrupt the brain function. So not all concussions require a visible external blow to the head. For example, a car accident, right? So the head and neck may snap forward during a sudden whiplash, shaking the brain back and forth. You might not have any physical damage to your face or head, or you might not even have any bruising, but the forceful nature of that, the snapping of back and forth, is your brain internally hitting the front or back, causing those coop injuries, right? Somebody might have a fall or impact to the body. Even if the head doesn't hit anything, that sudden snap in motion can cause the trauma into the brain. So let's talk about now concussions, the chain reaction inside the brain. So what's happening when you're having a concussion? So when a concussion occurs, it sparks a chain reaction of events into the brain. Let's break it down. So if you have axonal stretching and micro tearing, meaning the axons, which function like cables transmitting electrical signals between neurons during a concussion, these cables can stretch and tear. Even if they're only microscopic tears, this stretching disrupts the communication within the brain and between the body and brain. All right, next you could have an ion imbalance and neurotransmitter glut. What does that mean? That means the calcium and potassium ions can rush across and damage membranes of the brain cells. This disruption to the cellular environment leads to improper firing of the neurons. There is an over-release of excitatory neurotransmitters like glutamate, which overstimulates neighboring cells, creating further dysfunction and potential cell damage. Right? So your body's getting flooded with cells, and there is such a fine balance in our brain. It's pretty amazing when you think about it. The fine balance, and when you change that balance a little bit, your body goes into these different venues and avenues to overstimulate, and it causes dysfunction. And the dysfunction is what causes some of that fog and cloudiness and all the other symptoms that we just talked about. Energy downtime, metabolic dysfunction. Okay, so the brain relies on energy from glucose to repair and clean up after a concussion. However, the injury can reduce cerebral blood flow at a time when energy demand is skyrocketing, causing a mismatch in energy and need, which leads to fogginess and sluggishness. Inflammatory response. So the body perceives the injury as trauma and initiates an inflammatory response to the brain. This result can cause swelling, which further exacerbates symptoms and slows down recovery. So one of the questions that people need to understand is a concussion a mild traumatic brain injury? So the term mild traumatic brain injury is somewhat misleading because mild, the word mild, people see mild and say, oh, it's just mild, right? Because it's not life-threatening. Unlike more severe traumatic brain injuries involving bleeding or swelling that lead to structural damage. However, the effects of a concussion, a mild concussion, can be significant. Why mild can be misleading. Even mild concussions can disrupt a person's ability to think, feel, function at a full capacity for weeks or even months. Repeated concussions or inadequate recovery from a single concussion can lead to long-term consequences, such as persistent symptoms, post-concussive syndrome, or chronic traumatic encephalopathy, a degenerative brain condition. Okay, so one of the next things that we're going to look at is why are concussion complexes, why are they so difficult to diagnose? Okay, so diagnosing a concussion relies on a combination of self-reported symptoms, clinical tests, and neurological exams. Because the injury is functional, not structural, it can be difficult. So normal CT or MRI scans can miss a concussion because these images techniques aren't sensitive to temporary microscopic changes in brain function. Symptoms can also be delayed with problems and manifesting hours or even days after the injury. Prompt assessment is essential to rule out more severe injuries, brain swelling, bleeding, and ensure safe recovery. Let's break down the types of concussion. So understanding the different types of concussions is crucial for recognizing the severity and appropriate treatment approaches. Concussions are generally categorized into three grades. Grade 1 is mild, grade 2 is moderate, grade 3 is severe. So let's get into a deeper look at each grade. So grade 1, mild concussion. Symptoms are typically less than 15 minutes. Symptoms are typically transient and resolve within a short period of time. No loss of consciousness. So the person doesn't lose consciousness at any time. So some of the common symptoms you might see with a mild concussion is transient confusion, meaning temporary disorientation or momentary lapse in memory. Seeing stars, right? Visual disturbances or flashing lights in your eyes. Difficulty concentrating. You might have short-lived difficulty in focusing or paying attention. Dizziness. You might have episodes of dizziness or lightheadedness. Mild headache, often perceived as a low-level headache, which may be easily overlooked. The diagnostic challenges become because of the mild nature of the symptoms. This type of concussion is often overlooked, especially in athletes and patients who downplay symptoms or attribute them to fatigue or stress. Because there's no visible signs, makes it even more challenging to diagnose it without a thorough clinical evaluation. How does it affect your life? So mild concussions, while the symptoms are temporary, failure to recognize and address a grade 1 concussion can hinder recovery, potentially leading to more serious issues if another impact occurs, right? So it's not going to be that, but if you get a second concussion, that's when things start to really brew as problems. Okay, let's get into the next one. Grade 2 concussions, moderate. Symptoms persist more than 15 minutes, and they may fluctuate in intensity. For this one, you still don't lose consciousness. You remain conscious, but may experience more noticeable cognitive issues. So some of the common symptoms are prolonged confusion or amnesia, difficulty recalling what happened before or after the injury, headaches, persistent headaches that may require over-the-counter pain medication, dizziness or imbalances, ongoing issues with dizziness or balance issues, nauseous and vomiting. So you definitely might be feeling that sick and that nauseous feeling. Sensitivity to light and noise, development of a light sensitivity or sound sensitivity, mood change, mood swings. You could be irritable or mildly anxious. Diagnostic considerations. So neurocognitive testing, more in-depth cognitive testing to assess memory, attention, or reaction times. Observation period. Medical professionals may observe the patient for an extended period of time, could be several hours, to monitor symptoms for progression. Symptoms checklist. Use a standardized concussion symptoms checklist to document the severity. How does it affect your life? So school or work, moderate concussions often mean time off from school, time off from work to allow your brain to rest and heal. And you might have temporary activity restrictions of like physical activity and cognitive activity, including sports and computer screen time to prevent exacerbations. Okay, grade 3, severe concussions. This is the big boy. So with grade 3, you're going to have loss of consciousness, right? So the person may experience loss of consciousness, even if it's brief. It's a major distinguishing factor, right? So when you lose consciousness, you got a grade 3 concussion. Significant cognitive impairment. Severe disruptions that can last from days to weeks or even longer. Common symptoms include extended amnesia. Your memory loss might be extending from moments of the impact to potentially several hours after the accident. Severe headaches, often intense and persistent headaches, requiring stronger pain management. Ongoing nauseousness and vomiting. You might be having episode after episode of it. Profound dizziness and balance issue. You just can't find your balance. Everything is spinning. You have a lot of difficulty coordinating. Severe sensitivity to light and sound. You might have neurological defects, possible speech impairment, double vision, motor problems. And lastly, emotional and behavioral changes, marked mood swings, severe aggression or depression or anxiety that affect the quality of life. Diagnostic and management strategies. So imaging. So while CT or MRI scans usually don't show damage in mild or moderate cases, they may be warranted here to rule out complications like intracranial bleeding. Extended monitoring, close medical supervision in a hospital setting may be required, especially if loss of consciousness was prolonged or recurring symptoms appear. Comprehensive neuropsychological testing, in-depth evaluations to assess the extent of cognitive defects and help guide rehabilitation. The impact on life. Extended recovery time. Severe concussions often require extended periods of rest and rehabilitation, including time off work from school or work. Rehabilitation may be involved in physical therapy, cognitive therapy, or in certain cases, psychological counseling to manage emotional behavioral changes. Long-term consequences. There is heightened risk of further neurological injury or complications such as post-concussion syndrome and chronic traumatic encephalopathy. Other classifications. So in addition to the simple 3 grades, concussions may sometimes be classified based on their specific cause and pattern of symptoms, meaning physiological concussions primarily involve altered brain function without significant structural damage. Symptoms can occur headaches, dizziness, and cognitive changes. Vestibulo-ocular concussions affects the vestibular system, basically your inner ear and balance, and your ocular system, your eyes. Common symptoms are vertigo and visual disturbances. So you can't, you might have double vision and balance and coordination problems. Servogenic concussions. These are caused by trauma to the cervical spine or neck that secondarily affect brain function. Symptoms often overlap of those with whiplash and neck pain and stiffness. Complex concussions. These involve the combination of prolonged symptoms and multi areas of dysfunction. It could be cognitive, could be vestibular, emotional, often seen in patients with previous concussions and who have pre-existing neurological conditions. So next, we're going to talk about why differentiating concussions is so difficult. So classifying concussions into various types and grades is essential for developing effective treatment strategies. Different grades and types call for tailored approach in management, monitoring, and rehab. So safety in preventing further injuries from occurring, the recovery time allowing proper time to heal, and performance supporting recovery for optimal pre-injury function is essential in athletes and workers. Each concussion is unique and individual in responses to brain injuries and can definitely vary widely. So it's important to really understand what category they're in. Okay, so how does concussions affect your life? So typically, if you have a concussion, you can have these physical effects. And, we talked about some of these already, and it could be the headaches, could be the dizziness, the neck pain. You could have cognitive problems or memory loss or difficulty concentrating. You could have emotional problems with mood swings. And you can have functional problems like doing basic daily tasks. So it's really affecting all parts of your life. And it's that whole thing together that really impact how you're doing. Statistics do show that COVID-19 intensified delays care for concussions, right? So there's been some COVID links to showing intense delayed care for concussions. Okay. Next, let's talk about conditions that are associated with concussions. So concussions are complex injuries, often that don't occur with just one isolation. They can be accompanied by a variety of other medical conditions. Understanding that's important. So first, we'll talk about post-concussive syndrome, PCS. Post-concussive syndrome is persistent symptoms characterized by the continuation of the concussion symptoms beyond its typical recovery period. It could be weeks to months. Diagnosis is based when the symptoms last longer than the 3-month post-injury. Common symptoms can be headaches, fatigue, dizziness, cognitive changes, and emotional changes. Next, we'll talk about cervical injuries as an associated condition. So when you have the neck trauma, the whiplash, just snapping your head back and forth, that neck pain and that whipping can cause the neck pain, the headaches, the decreased range of motion, tingling in your hands and fingers. Vestibular disorders. So when you have the inner ear dysfunction, concussions can damage the vestibular system, which is crucial for balance. So for that, you're going to have dizziness, vertigo, balance issues, visual disturbances, and nauseousness. Sleep disorders. So concussions often disrupts the brain's ability to regulate sleep. So if your sleep is irregular, you could have insomnia, basically difficulty falling or staying asleep, daytime sleepiness, excessive tiredness, restless sleep, meaning frequently getting up due to poor quality sleep. When you have poor quality sleep, it's going to affect your life by your cognitive function, right? Your poor sleep is going to impair your attention, memory, and problem solving. You might have mood changes increased irritability, anxiety, depression due to lack of restful sleep, overall health problems. Chronic sleep problems can affect overall physical health, making recovery slower. The mood disorders. So when you get a concussion, that can lead to significant changes in mood and behavior. Common symptoms include depression, persistent feelings of sadness, hopelessness, or loss of interest, anxiety, increased feeling of worriness or fear, irritability, easily frustrated or angry, emotional instability. You might have mood swings or outbursts very quickly. So these things affect your life by affecting your interpersonal relationships, strain on family, friends, loved ones, coworkers, daily function, difficulty performing daily tasks due to emotional burden, self-care, changes. You might have changes in your personal care and hygiene, right? If you don't care, then you don't take care of yourself. Okay. We're getting through this. I know it's a lot of stuff, but it's important to understand it. How do you treat a concussion? So typically treating a concussion requires a multidisciplinary approach, often physical, cognitive, and emotional recovery strategies. While a concussion is considered a mild traumatic brain injury, its symptoms can vary much in all of its effects. So the nature of it really depends on the treatment that you're going to do for patients. So immediate care after a concussion. Obviously, remove yourself from the physical activity, right? Prompt rest. At first, suspicious of a concussion, the injured person should be immediately stop physical activity and mental activity, especially if the incident occurred during sports or physical performance. Avoid future collisions or injuries is crucial in preventing what's known as a secondary impact syndrome, a rare but life-threatening condition in which a second concussion occurs before the first has healed, leading to brain swelling. Neurological assessment. So after an injury, seek medical evaluations by a qualified healthcare professional. The evaluation typically reviews a whole checklist of symptoms, and they'll go into memory loss, headaches, dizziness, and they'll go into a whole bunch of different things of what's happening with you neurologically, right? They're going to maybe ask you some basic questions like what's today's date, who the president is, what state are we in, all kinds of questions to identify how you're feeling. Next thing they're going to tell you to do is rest and recover, right? The first phase of treatment is rest, cognitive rest, reducing brain stimulation to avoid exacerbating symptoms. So it could be avoiding schoolwork or work in general. Short-term leave from school or work may be necessary to prevent cognitive overload. Limited screen time, so reducing your exposure to phones, computers, and TV. I know in today's day and age, oh my God, how could you live without your phone, your TV, your computer? But if you have a concussion, you have cognitive problems, you need to back off and take that time down. You don't want your eyes straining and your brain straining. Avoid multitasking. Avoid activities like reading, writing, and problem solving when you're in this stage. Key is physical rest, hydration, and nutrition, right? You're going to drink a lot of fluids and you're going to take your vitamins. And symptoms monitoring. You're going to monitor those symptoms and you're going to talk to your provider if they're getting worse. So the next step in that is going to be gradual return to activity. So once the acute symptoms, the headaches, the dizziness, or nauseousness begins to subside, patients can typically gradually resume normal duties under medical guidance. The process is often carefully structured into stages, right? So you're going to slowly return back to your normal activities. No physical or cognitive stimulation, though, until your symptoms improve and last for more than multiple days, usually to at least 3 days without having any problems, right? So you're going to keep slowly progressing. You might go back to light activity, low impact physical activity, such as walking, a short duration, or a little bit of cognitive, like reading. You're going to avoid complex cognitive functions. You can go into the mild, all right, and then slowly start to go back to work and school, and then slowly bring up your screen time. Conservative treatments for concussion. So conservative treatments just focuses on non-invasive approaches and natural recoveries. So typically, patients can do physical therapy and rehab after a concussion. The neuromuscular system, the balance, coordination, and posture can be affected. So if that's the case, then physical therapy can help focus on some exercises and some vestibular therapy or cervical therapy to help treat or heal. If you've had cervicogenic headaches from that post-traumatic concussion, chiropractic care could be warranted to help remove those spinal misalignments during those impacts. You might have cognitive rehabilitation therapy, right? Concussions often impair memory, attention, and executive function, which can impact daily life, academics, or work. So memory exercises improve recall through structured therapy and those type of strategies. Computer-based cognitive therapy, so interactive programs to retain task switching, problem solvings, and plannings can be the next step into that. Many concussions patients experience mood disorders. So if you're having mood disorders, then you're going to want to talk to a professional about those mood disorders, whether you talk to a therapist or maybe your medical doctor will put you on medicine. Sleep therapy. So concussions often disrupt the body's ability to regulate that sleep-wake cycle. So treatments may include temporary use of some vitamins, could be like melatonin or valerian root or different things to help sleep aids. You might have cognitive behavioral therapy for insomnia and sleep hygiene, right? Avoiding coffee before bed and avoid those large amounts of water before bed so you're not constantly getting up. Medication. So a lot of times they're going to talk about pain medication. So chronic and severe headaches may require prescription medications for migraines, and there are a lot of different medications out there. They may also put you on if you're getting nauseousness, they might put you on anti-nausea medication, and they might put you on anti-inflammatory inflammation medicine if you're getting inflammatory problems or if they have any swelling in the brain. Managing long-term complications post-concussion syndrome, if the symptoms persist months after concussion, is important to understand. So the specialists are going to talk about the neurologist, your psychologist, and you're going to have vestibular therapy. It's important to make sure if you're having those post-concussive syndrome effects, you really evaluate it. So, final note on prevention or re-injury. So, education, recognizing and understanding concussion symptoms early and taking them seriously is vital for long-term health. If you're playing sports, helmets in sports, seatbelts in cars, and fall prevention strategies in homes and workplace can mitigate risk factors. Reintegration into activity should always be followed by a clearance protocol set by your healthcare professional to minimize the risk. A concussion isn't just a bump to the head. It's a neurological event that ripples through your entire body, impacting your neck, your spine, your nervous system, and your emotional health. The path to recovery requires a multidisciplinary approach that can put it all together for you once they understand what is happening to you. So, as I say with all my podcasts, the information that I just shared for you, I hope I've given you some good information that can help you, family member, or somebody you know. If you or anybody you know is experiencing a concussion, please pass this podcast along to them. Some of this information can help them get to the next level. Maybe they understand something they haven't thought of before. And as always, The information I've given you is my opinion alone. This information is not medical advice, not medical treatment. Please see a qualified medical provider to diagnose, treat, and get you through a concussion if you might have one. We hope this information and this ultimate deep dive into concussions gives you some clarity on what they are, how they affect your body, and what some of your options are. Thank you for joining me in this episode today. Be sure to subscribe and tell your friends, and there'll be more deep dives. I do a lot of deep dives on a lot of issues. If you have one that you want, shoot me an email, pop onto that YouTube and send me a message, and I'll be happy to do what I can for you. As I always, stay safe, stay informed, and most importantly, take care of yourself. You only got one of these because at the end of the day, health matters. Till next time, I'm Dr. Michael Chalemi. Be well, be safe, be healthy.